This is the front of the heart. We know because the auricles are facing frontwards. We turn it around and we can see the blood enters the heart through two large veins, the inferior and superior vena cava. It empties oxygen-poor blood from the body into the right atrium of the heart. Once the atrium contracts, blood flows from your right atrium into the right ventricle. That's when it goes through the open tricuspid valve, and when the ventricle is full, this valve will close shut to prevent the blood from flowing backward. The blood will then leave through the pulmonary valve into the pulmonary trunk and arteries to the lungs where it's oxygenated. This is where the pulmonary veins empty into the heart. It empties oxygen-rich blood from the lungs into the left atrium. As the atrium contracts, blood flows from the atrium into the left ventricle through the mitral valve. This valve will close so the blood won't flow backwards. Once the ventricle contracts, the blood leaves the heart through the aortic valve into the aorta and to the body. There's the aortic valve. Ready? Chordae tendineae connects to 3 cusps in the tricuspid valve and 2 cusps in the mitral valve. The chordae tendineae are referred to as the heartstrings because they play a vital role in holding the valves in place when the heart is pumping blood. It then pulls the flaps, holding the valves in the closed position. The papillary muscles are muscles located in the ventricles of the heart. They attach to the cusps of the tricuspid and mitral valves via the chordae tendineae and contract to prevent prolapse of these valves. The aortic arch is the portion of the main artery that bends between the ascending and descending aorta. The aortic arch has 3 common branches: brachiocephalic artery, left common carotid artery, and left subclavian artery. The brachiocephalic artery branches into 2 more arteries, which are the right subclavian artery and the right common carotid artery. Then off of the ascending aorta, you will find the right coronary artery and the left coronary artery. Then off of the ascending aorta, you will find the right coronary artery and the left coronary artery.
This is the size of a normal left ventricle on a normal heart, but if you had a left hypoplastic ventricle syndrome, it would be way smaller.
Hypoplastic ventricular syndrome is a birth defect that is known to affect the normal blood flow through the heart.
The problem with this disorder is that the left side of the heart does not form correctly. It is considered a critical congenital heart defect because of the fact that the newborn will have to have surgery or procedures done soon after birth. There are many structures in the heart that do not fully develop. For example, the left ventricle, the mitral valve, the aortic valve, and the ascending portion of the aorta. Oftentimes, babies with this syndrome will also have an atrial septal defect, which is a hole between the left and right upper chambers of the heart. In a baby with no heart defect, the right side of the heart pumps blood from the heart to the lungs, while the left side of the heart pumps oxygen-rich blood to the rest of the body. However, with babies with left hypoplastic ventricular syndrome, the left side of the heart can't pump oxygen-rich blood to the body properly.
Centers for Disease Control and Prevention estimates that about 960 babies in the United States suffer from this disease. That's about 1 out of every 4,344 babies. It's not a very common disease, but unfortunately, it's the same disease that Will Cohn suffered from.
Diagnosis. This syndrome is diagnosed during pregnancy or closely after the baby is born. Tests during pregnancy, called prenatal tests, check for things like birth defects. A regular ultrasound can be enough to suspect left hypoplastic ventricle syndrome. If that's the case, the fetal echocardiogram may be suggested by the healthcare provider. With the fetal echocardiogram, it zooms in and takes an ultrasound of strictly the baby's heart, which will confirm or deny the diagnosis. Abnormal wishing sound is what the doctor will hear. The symptoms of having this syndrome is a few days after birth, 2 detours in the heart called the patent ductus arteriosus and the patent foramen ovale close, and this is when the blood of the heart is forced to take the regular path and problems occur. Problems such as pounding heart, breathing issues, bluish or ashen skin, and a weak pulse. If not done while pregnant, an echocardiogram will be suggested to diagnose if the healthcare provider hears a heart murmur or if they figure the syndrome is occurring. Okay, the risk factors. If you already have a baby with left hypoplastic ventricle syndrome, you have a higher risk of having another baby with the same condition or a similar one. Beyond the family history and genetics, there is no real risk factors of the syndrome. Same with prevention. There is not a specific known cause of left hypoplastic ventricle syndrome, and there isn't a way to prevent this condition. If you have a family history of heart defects or have babies who have had babies with heart defects, consider talking to your doctor before experiencing pregnancy. The syndrome can be treated with several surgical procedures or a heart transplant. The first procedure is called the Norman procedure. It's typically when the baby is around 2 weeks old. The surgeons will go in and reconstruct the right aorta and directly connect it to the lower right ventricle. This allows the ventricle to effectively pump blood through both lungs and to the body. Next procedure is called the bidirectional Glenn procedure. In this procedure, doctors remove the first shunt attached to the pulmonary arteries and then connect it to one of the large veins that normally returns blood to the heart. Lastly, the last procedure is called the photon procedure, and during this, surgeons create a path for the oxygen-poor blood in one of the blood vessels that returns blood to the heart, which is the inferior vena cava, to flow directly into the pulmonary arteries.